Hello and welcome back. So, we want to see what's the sign of shame. And I have Coach Bonnie with me here. Welcome to program.
Hello, good to be with you, Amir.
It's pleasure to have you here. So, what's the sign of shame?
Sign of shame. There are many signs of shame, but before we get to the sign of shame, let's see what shame really is. Like in many years ago, way back, shame was actually a sign of survival. We didn't want to be shamed for survival reasons, because we as humans, as mammals, live tribally. We live in communities. We live together, and if I did something in my tribe that was not acceptable and I was shamed, I would be kicked out of that tribe or that community, and I had to survive on my own. So survival became a very essential part of not being shamed. And shame is basically means that I am bad. The meaning that it gives to the person is that I have stepped out of my boundaries and I did something that I shouldn't have been done. So shame, in a way, is one of the most negative feelings one can have. Imagine having poison in your body, and instead of cleansing your body. So when we have food poisoning, what happens? We go to the emergency room and they pump the poison out of us. That is the way that we can get rid of the poison. Now, if we don't deal with shame, the negative effect that shame has on our body, it's like we swallow the poison and we allow it to stay in our body. Eventually, it brings all the other negative emotions with it. It brings guilt with it. It brings low self-esteem. All of the other negative emotions trickle down because of shame.
Right.
Does that answer your question?
So, yes, but obviously start with the childhood, how shame built in our mind or our body, how should I say it? It's going to be starting childhood, but when we feel, why we, as an adult, when I feel blame, when I feel I don't have enough self-confidence, when I have anger, when I have a temper problem, and it's all of this comes from shame, right?
Some of it comes from shame. Shame, you mentioned something coming from our childhood. So let's see how shame builds up. When, as a child, my mother constantly tells me, you're not good enough, you are fat, or you did that thing again, or you did this again. All of these negative talks that comes from parents, from caregivers, from teachers, from media, from our community, from our culture, anytime that I step out of these norms, I feel shame. I feel that I've did something bad. I'm not acceptable in this community anymore. For example, like homosexuality was not acceptable till recently, and nothing wrong with it, but it was so out of norm, so out of the standard and the way that our lives described as normal was that someone that was homosexual was not able to say it because of the fear that not being acceptable. Shame comes from having different kinds of value sets. What is shameful to me might not be shameful to you. Let's say I do something really silly and the next day I feel really shameful and I can't even face my friends. But that same act, if someone else does it, they don't feel the shame. So shame comes from how our values have been set from the beginning, from our childhood, from our culture. the way we were brought up, what was said to us, it's good and it's bad. All of the goods and bads and rights and wrongs that we were told as a child, and then therefore we made them to be our truth, and we made it to believe them to be as real. Those are the standards that we hold ourselves true to. So if any of these values, if any of these standards are broken by me, then I feel shame. Now, my shame and your shame might be different. Personal shame is different. And society brings another kind of a shame to us. They are telling us through the media, through social media, everything, every day we are being told that you need to live a certain way. You need to look a certain way. And if I don't abide by those norms, then I am being shamed. For example, something as silly as women having extra weight on them. Nowadays, it's shameful to be overweight. We see commercials going around summertime that don't feel ashamed to wear a bikini and do this exercise or do this, eat this pill and lose 10 pounds to be able to feel confidence in your bikini. Why not feel confident as an overweight? Who says a normal weight not to be shamed is a certain number? So it's like a self-inflicted wounds that we put on ourselves in order to live by certain standards. Therefore, if any of these standards are broken, then we are being shamed.
Okay, it's very close to lack of self-confidence. It's very close to perfectionism. All signs is very close together. This type of
It's what
people.
you give meaning to. What you do as wrong is how you give meaning to it. Two people can do the exact same thing. One may feel very excited, very jolly, and very proud of what they're doing, but the same act done by a different person can bring extreme shame to that person. So it's all about how we have been brought up, what our values are, and what we stand for.
Right, right.
And one way that you mentioned self-esteem and self-confidence, absolutely, absolutely. If I don't feel confident, if I have low self-esteem in myself, then I am being very watchful of what people are saying and doing and how they are reacting to my actions. Another person that with self-confidence does it no matter what,
Okay.
goes out and is visible and does what they need to do in order to get to where they want to go. And another person, because of they are constantly thinking what someone else it might think and what someone else might say, they refrain from putting foot forth and taking action. So self-esteem plays a very, very crucial role in how we build up self-confidence, and therefore not being so sensitive in feeling shame in the things that we do.
Okay. What we should to do?
That's a very great question. One thing that people can do is separate who you are from the behavior. You've done something silly. You've done something stupid. That is not who you are. So if you're able to separate these two from one another, then that's a major point in accepting shame. Okay, I did something silly. Acknowledge it. Say it. Say that I did something wrong, or that to me this was silly, and stay with the feelings. What feelings are coming up for you? The feelings that are coming up for you are the action, what you have done that is so shameful to you right now. Does it matter in 5 years? Or are you going to look at it in 5 years from now, a year from now, and laugh at it? Sometimes when we are in that moment, we are so into the uh, into the event that we're not able to see outside. Now, ask yourself, is it really a threat? Was it really that bad? And not putting guilt or fault at yourself. Shame, the symptom of shame is that you put guilt. Guilt comes up. I did something bad. I wasn't good enough. I did something stupid. I'm not worthy of this. I'm not capable. I'm not competent. When we put guilt on ourselves, that's when the trickle down effect of all the negative emotions comes into play. And the very important one is that, again, realizing that shame, no matter how much guilt, how much remorse, how much you ruminate your thoughts about the event, none of that is going to change what has happened. None of it is going to erase the past. So instead of ruminating constantly and putting yourself into that situation again and feeling all the negative feelings, say to yourself, okay, I did it. Is there anything I can do about it? Maybe confront the person, or if you can have a conversation with a person that this was done, make it so that it is not about you. It's the action that you did. It's not who you are. I did something wrong. Apologize from it and move forward. Simple as that.
Okay,
Although we make
if
it, although
if that person accepted.
that doesn't matter. That doesn't matter. What I am only responsible for my actions, for my response, and for what I do. I am not responsible for how you respond to my apology or how you want to take that apology. The best that I can do at any given moment is my personal best. I cannot make you change your mind. I cannot make you feel a different feeling. Those are all your feelings. You deal with your feelings, and I take responsibility for mine.
So I took a responsibility. I say apologize. I acknowledge all that things, and then I'm ready to fix or improve or all things. But in that way you say it's easy, but in reality sometimes it's not easy, because when you are in the relationship, just imagine when you are in a relationship and you did something and you don't want to feel shame, and you're going in the right way with the effective communication and going step by step, do your part, but in the other side she or he don't want to accept it, and then we are going to the different area. I know we are going to the
That's fine. That's fine.
we are going to healthy relationship or unhealthy relationship.
In any relationship, we are in relationship constantly. Everything that we do is in relation to someone else, and sometimes we are in relationship to ourselves. So again, the best that you can do is your own personal best. If you come genuinely, sincerely, authentically, and talk from heart, I am almost sure 100%, not 99.5%, that the other partner will accept. And if they don't accept, it's not about you. Don't make it personal about you. If they don't accept, it means that there is something they got triggered. And they always, when you get triggered and you react to something or an event that was outside of you, that means that something inside of you, something inside of yourself has not been healed. That's the only time that you get triggered. Triggers are signals that you need to look within. So if that person is not willing to accept your apology, there might be deeper issues in the relationship that is holding them back from accepting your apology or explanation.
We are going to a different area. That's going to be another program. But the key, let's go with the key. One more time. What we should to do. One key.
One key, separate the action from who you are.
Very good. Thank you so much, Coach Bunny, and see you next time. Okay, very good. Stay tuned with me. We are going to New York. Hello and welcome back. I'm here from Los Angeles with you. We are talking about shame. Do you feel shame? Come on. So yeah, lots of people, they feel shame. Maybe yeah, definitely. Let me think about that. So I'll let you know. Let's go to New York and see who is here. Hello and welcome to program.
Hello, good evening. How are you?
I'm great, thank you. How are you?
I'm very good. Thank you for asking.
Oh, very good. You're welcome. So, we are talking about shame.
Yes.
And how shame built in our mind or our body. I don't know. Let's go with,
All right.
yeah, with this question.
Yeah, that's a nice question actually, but it's a negative feeling. Shame is a negative affect, negative feeling, and a negative emotion actually that we get it from being not in attention area. When the parents are not giving enough attention to their children, the child usually feel shame and feel restricted. They are trying to close themselves. They are not making the eye contact. They are not listening to you, and there's a lot of consequences for the negative feeling. The child started feeling anxious, nervous, sometimes deflated, depression, and then if they are a little bit bigger or elder, and they are passing the teenage age, probably they are get towards to addiction.
Okay. So, I didn't get that. Tell me more about that, please.
What do you need to hear? Actually, you want to know the definition, or you want to know about the consequences, or you want to know about the neurochemistry of the brain, that how to process and how does it build in our brain.
Yeah. So let's go with because shame started from our childhood. Maybe we are just when gonna be a start in the first few months, or when gonna be a start?
When the child understand that there is something as I, because when the child comes to the world, there is no separation between the child and caregiver. They believe that the unity of the child and caregiver is the same. So that's why when the caregiver is moving out, they bring up the separation anxiety. The moment that the child is able to understand that his or her own inner self is different from the caregiver, they understand that my action deserve consequences, and if I get the positive attention from the parents or caregiver, I feel capable, I feel positive, I feel growing. But if I get the negative effect from them, they try to put the negative names on me and calling me by the names, I feel shamed and closed, and little by little feel deflated. And the low self-esteem is the consequences for the little child.
What's the sign of shame? How I should find out, okay, this anger comes from shame, or I have a lack of self-esteem and it comes from shame, or I have I get angry very soon, so this is come from shame, or I have an addiction and this addiction is come from shame, or there is a list. Oh my God, there is lots of things.
Yeah.
and
they are so tangible to each other. They are
and it's
so,
very, and the sign is very close to the other, things like other issues. So what's
absolutely.
exactly sign of shame?
Well, the first sign of the shame is that you feel negative, you feel unhappy, you feel that there is something wrong with me. I'm not worth it. I'm not enough capable to do this stuff, and feel that I do have a low self-esteem. I'm not enough for the people, and whenever I go, I didn't get enough attention from them. So little by little, you started building up the sense in yourself that I'm not worthy enough for the people to get their love, to get their attention. Instead, I'm the piece of the garbage that everybody put their negative effect or negative words on me. And sometimes I'm doing a workshop with my students regarding that. If I want to put the label on you, I tried to put the stickers on the body, face, upper part of the body, lower part of the body, and little by little you see that there's a lot of paper stick to your body, and there is no
Mm.
room for the breathing. So that's
Mm.
why exactly negative effect does with us and our children.
So if I am scared of the beyond people judge on me, it's come from shame. People judging
Fear
me, and I feel oh, this is fear. Okay.
Fear, yeah, fear
Mm.
is different from the shame. Well, when we want to define the meaning of the fear, fear is that kind of negative feeling when there is unknown stimuli. I have no understanding about what's going on. So there's a lot of question mark in front of me. So that's why I do have the fear. Sometimes
Mm.
we do have the fear towards the physical stimuli, such as you see a big lion in the middle of the jungle. So that's why you feel that there's a fear there. But when there is unknown stimuli in the real world, you feel a fear and anxious.
Okay. So, and same question I ask to Coach Bonnie, what we should to do.
I believe that if we understand that what's going on with the neurology of the brain, what part of the brain is responsible for this negative effect, and then we can work on it.
Mm-hmm.
I believe that the majority of the feeling and the memory and interpretation processing happening in the mesolimbic system. Mesolimbic system contain a circuit that we call it as a Pappas circuit or MacLane-Pappas circuit, which is associated with our feeling, with our emotion, and interpretation to the event. So if I know that my feeling comes from temporal lobe in the Pappas circuit, I understand that feeling is temporary, and this type of the feeling comes from my side. This is not something outside really that caused this type of the feeling. And then when I do have enough information and insight regarding that, there is no external stimuli outside. It's just me and my interpretation. With the therapist, we can work on clearance and improvement.
So, as a psychiatrist, is it any medication for that?
We don't have medication for the shame, but we do have a lot of medication for the consequences of the shame, which
Mm-hmm.
is low self-esteem, depression, anxiety. And personally, I'm not a fan of the medication. I always go with the first line of the treatment, which is not medication, trying to do the therapy, trying to use the other modality to, give a little bit of improvement to the, patient or client. But if it's not possible just with the therapy and the different modality that we do have, then we should, unfortunately, use the medication.
So, which kind of therapy is gonna be takes long, right? But some
Absolutely.
people they don't want to feel bad and all the time. I don't know if some people, they have this issue. It's gonna be constantly every day, right? With a different reason they feel bad, and so. What's the best? Is it cognitive therapy, behavior therapy, or
Oh yes, we do.
going with the you mentioned about uh,
You, you
neuroscientist, or is very complicated. Looks
it,
like
it depends on
complicated.
the case. Yeah, it depends on the case actually. If we are dealing with the personality disorder, with borderline personality disorder, we usually they do have the feeling of the emptiness, shame, and anger, instability in the relationship, suicidal ideation, or hurting themselves by cutting behavior, or all this stuff. We usually go with the dialectical behavior therapy, or DBT. And based on this type of the intervention, the client or the patient will understand that we do have the opposite feeling at the same time in one individual, and that's okay. We are trying to validate the feeling of the patient regarding that. If you do have this two strong positive and negative feeling at the same time, it's okay. It's happened for everybody, and you don't have to be react to it, or overreact to it, by cutting yourself, or having this suicidal ideation. But if we are talking about the other group of the patient, usually CBT is working.
So this type of people, as you mentioned, I can just imagine they have anger about everybody because they don't love themselves. They cannot trust anyone. They have a trust issue, right? They have a anger about people. They have, because you mentioned about borderline personality disorder. Then we are going to the very big area, and when you mentioned that, I was thinking, and I said, oh yeah, I can remember someone with all of this sign. So signs has lots of red flags. So anyhow, let me just so and now
Let me give you a
I'm
very short and brief explanation about the borderline personality disorder. The most
please.
mechanism, yeah, the most important mechanism defense of this group of the people is splitting. Means that they do have the bad and good. They do have the positive and they do have the negative. Either
Mm-hmm.
way, you are in the good line or you are in a bad line. It's
Mm-hmm.
up to your luck actually. Or sometimes they switch you in different position. One day they are coming to the therapy session, to the office, and you are the best psychiatrist ever, and the next week you are the worst one.
Mm-hmm.
And sometimes the physician is a very good one and the nurse is a very bad one. So they do have the splitting. So yeah, it's very common between them, and you shouldn't get it personal if they are giving you the label, or they are transferring their negative effect to you. It shouldn't
Mm-hmm.
come to you, because this is inner feeling of them, and we are trying to modify it, or decrease, or hopefully improve the negative to positive feeling.
Right, right. And they are very good with manipulation, and they changing the mood, and they changing the subjects, and yeah, exactly. So
Look like London weather.
right, right. So Dr. Khorramshadi, you yesterday in your program, it's Tuesday, every Tuesday at 4 p.m. Los Angeles time. You start talking about healthy and unhealthy relationship, right? And then
Correct.
it's a different area, and you start with communication, and
Correct.
verbal and unverbal communication, different type of communication, and all of this. I'm very interested, and I cannot wait to continue this topic next Tuesday. Hopefully we're going to continue with that, right?
Absolutely.
Very good, very good. So, and now if you want to talk about a key about shame,
Shame comes from the vulnerability, and I believe that the base of everything is our vulnerability, and vulnerability is not a weak point. We should understand, and we should learn, and we should practice it in our daily life, that all of us are a vulnerability. But the one is more successful and more functional in the society is that to be able to see, to notice, and to understand what is my weak point, what is my vulnerability, and then based on my vulnerability, I built up something that covered that area, not just for me, for the rest of the people that they do have the same or common symptom with me. I do remember that one of my students actually was failing in the exam, and he came to me and said that I don't know how to pass it. It's too difficult for me. And I said that what is your weak point? And I said I don't know. And I told him that okay, go and find out what was your weak point regarding the passing the exam. And then he came back next week and find out that there is 2-3 factors that he has to work on it, and then pass the test. So he comes with the idea that how many people does have the same problem as I do, and he comes with a big number. And I said that okay, so find a way that works for yourself and for the rest of the people that they do have the same problem. And he did, and actually not pass the exam. He passed it with a high score, and he was helping the other people with the same problem. So I believe that vulnerability is not a weak point. It's a positive start point for the innovation, for creation, for a lot of things, for the development.
Do you mean, okay, be vulnerable, be authentic, and share your feeling?
Absolutely, yes. But you should do it with
First, but sorry, I interrupt you. So first, we need to feel our feeling. We need to know about our feeling. That's a big point.
As I always said that awareness is a 50% of the way. Yes, we have to notice, we have to be aware, we have to have enough knowledge and acknowledgement about what's going on around us.
So we have to be aware. I am aware of that, and then I acknowledge that with the authenticity, and then let it go, because I deal with my part and then the other side. So you are in a relationship, you are in a relationship, and the other side, he or she don't accept it. Okay,
there is no force to put the pressure on the people to accept what we are feeling, or what we are understanding, or what is our interpretation. We do have the different cerebral cortex. We do have the different type of the neurons with a different type of connection, and it means that I'm totally different. Even though with my sister that we do have the 50% of the genetic component from our parents, or from mother or father. So when I'm totally different from my sister, how can I be expected to be close to you or other individual, and expected that you understand my feeling or my emotion and be responsive to all of this emotion at the same time? This is not going to happen.
It's mean when we did our part, there is no reason to blame myself.
Absolutely, I agree with you.
And in that time, I don't feel shame.
No, there is no shame. Everybody have the same negative feeling, but this negative feeling is the starting point for building up creation and innovation and development. And I believe that all of the people that make something has been in the vulnerable position, and feel the pain, and then like a small planet grow and then come out and develop good stuff.
You remind me something I want to share with you and all of our audience. So something happened something around 3 years ago, and it was so bothering me every time when I start talking about that accident. I call it accident. I was crying like a baby and talking about that. And my therapist mentioned to me, you feel shame about that accident. I said no, and because I didn't know comes from shame. When I, deal with my feelings and understand all of my feelings, and then I figure out, oh yes, it's coming from shame, because I feel, I blame myself all the time. I feel shame why I did this, and then it was an accident. It was very bad feeling. But when I after long term, it's couple months therapy, after that, when I start talking about that accident, I never feel shame, because I feel it was an accident. It wasn't in my hand. It was maybe 50%, but it's happened. When it's something happened and it's bad, how can I fix, or how can I improve it? So, and sometimes it's like this paper, and then I cannot, make it like a few seconds ago.
One.
Yeah,
Yes.
it was just a few seconds happened. So
I totally get your point.
I did my part to acknowledge, to share it, to try to fix it as much as I could. I did, and then after that, I don't feel shame about that accident.
That's true. That's absolutely, I agree with you. We usually tell our patient or client that, before any event is happening, we do have a checklist. We are trying to do our best to prevent anything as a, negative or a side effect or any type of, bad consequences. We're going to, put the checklist mark regarding that. I check this one, and then, if anything happened, it's not the individual or the person. We don't have that much control over all of the factors around us. We cannot control any single consequences of the other parameters around us. So I believe that we are doing our best to take care of the good events of the consequences and situations. But if anything happened, it's better to understand that I did my part, and I try my best, but the outcome is not what I like.
Right. So we know neuroscience is very more powerful and is coming strongly to cover lots of things, and it's gonna most of the issues gonna be easier. I hope so. Hopefully. So anything special from that area can help to shame.
Well, I already explained that the mesolimbic system is the one that regulated our emotion, our memory, our
Right.
Perception about the stimulus. And the most important part of the Apophis circus or Apophis McClain circus is about the anxious and anxiety is amygdala. But for the shame is not the amygdala, is a cingulate. That part of the brain is the most important part that send the impulses for us to feel restricted, to feel anxious, and to feel depleted and shameful at that time. So yeah, neuroscience understand that what's going on over there. That based on the pathophysiology of the shame and different chemical that comes to the blood and to the system. Well, that's why we can bring up the good feeling about the visualization of the good results of happening around us. That's why we usually use the visual modification. We are usually using the auditory modification to bring up the good impulses to the person, and they tell them that this is the picture, the real picture, and this is your interpretation and your understanding. I never forget about an anorexia nervosa girl that I had it in my clinic, and I was talking to that girl, and she was pretty skinny. She was almost tall and almost 100 pounds, very tiny. I mean,
How
in the
tall?
muscle, um, almost 5'5", 5'7", and then he was 100 pounds, very, very,
Very
tiny in his
tiny
little,
body.
yeah,
Yeah. Skinny.
very thin body. And then,
Yeah.
she says that I'm very fat, and I'm not going to, drink this, a regimen that you gave me, because we had tried to, started with the Pediasure and nutritional liquid, and she was saying that, I'm very fat, I'm not going to do that. And I said that, okay, let's measure your waist, and I'm going to measure my waist. And do you believe that, I'm a fat person, or you feel that, I'm overweight, or I'm okay? She was saying that, no, you are okay. And I'm very fat. Okay. We were trying to measure the waist, and then we did. For her was very tiny, very small. I can even grab the waist of the patient with my hands, and
Wow.
for myself was a little bit larger. And when I was open this string and tell her that, this is the number for you, and this is the number for me. So which one are, fatter or overweight, or which one are, bigger in the skeletal habitus? But she
Let
was
me tell
saying,
you. Let me
no,
tell you her answer.
absolutely. You tell me.
No, that's yours. That's mine. It's wrong.
No, no. She says that, okay, I get the number, but I feel it that I'm fatter than you. I'm more over than you. And I said that because you believe in that, your core belief system, your mental, neural system is telling you that you are fat, you're overweight. This is your interpretation. But the fact is the number. I gave you the number. Your waist is this, and my waist is like that. So, number is talking to you, but you want to believe that you are,
Then you should
overweight. That
work. You should work on belief system.
yes, yes, yes.
Thank you so much, doctor, and I hope to see you next time in next program. It was amazing. Thank you so much, and
Thank
have a
you. Had
wonderful
a
evening.
good time too. I
Thank you.
really enjoyed. And
Me
have a
too.
good night.
Thank you. You too. Bye bye.